Feeling short of breath from time to time is healthy and normal. It's a natural response when your body needs more oxygen and energy when you do something requiring effort. The reason for breathlessness is that the body needs more oxygen than it's getting, but sometimes people get out of breath whether or not they're physically exerting themselves, and it becomes difficult or uncomfortable to breathe. So you breathe faster to try to increase the flow of oxygen-rich air into the lungs. Breathlessness isn't just a physical symptom, it's also a feeling that affects the way we think and act. If breathless, you can feel very hot, panicky, or overwhelmed, or that your chest is tight, or like you're suffocating and you need to take deep breaths but you can't, or like breathing is just such hard work and exhausting. Getting out of breath can be frightening and make you feel very anxious. That anxiety or fear can increase how breathless you feel. As we get more anxious, we may become more aware of our breathing and then breathe faster and tense our breathing muscles, and this can often lead to a panic attack. If you have breathlessness, you experience shortness of breath and difficulty in breathing. The medical term for shortness of breath is dyspnea. There are two main types. Sudden onset breathlessness is when you get out of breath suddenly and unexpectedly. This always needs medical attention, and it's the commonest reason people visit the emergency department and call for an ambulance. You need to call 999 or get emergency help if you're struggling to breathe, or if you have sudden shortness of breath and your chest feels tight or heavy, you have pain that spreads to your arms, back, neck and jaw, or you feel sick or are being sick. These things could mean that you're having a heart attack or a serious problem with your lungs or airways. Persistent breathlessness is shortness of breath that persists beyond a month, usually due to a chronic condition like COPD or heart failure. You should see your GP if you have shortness of breath and it's lasted longer than a month, or it's worse with activity or when you lie down, or you've been coughing for more than 3 weeks, or you have swollen ankles. These could indicate various different types of chronic diseases, and they need to be checked out. There are loads of different causes of shortness of breath. When we talk about sudden onset or acute shortness of breath, we're thinking of flare-ups of lung problems like asthma, pneumonia, COVID-19 and COPD. This is a blood clot that can occur in the lungs, usually after a clot in the leg or after immobility or surgery. Heart failure can cause excess fluid to build up in the lungs and ankles, causing shortness of breath. Anxiety causes shortness of breath, feelings of panic and palpitations, and other causes like pain, anemia, and some medications can even cause it. Some causes of persistent breathlessness are similar to the sudden onset causes like lung conditions, asthma and COPD, and heart conditions like heart failure. These are all long-term conditions that can usually be managed, but sometimes they get worse and flare up and become acute, i.e. in need of immediate medical attention. Flare-ups of asthma, COPD, and heart failure make up a lot of what goes to A&E and what we see in clinic too. Other persistent causes of breathlessness include things like heart rhythm problems, like atrial fibrillation, where the heart is less efficient and less oxygen is being pumped around the body, so you need to breathe faster to get more oxygen. This rapid breathing makes you feel breathless. Or anemia. Having less hemoglobin through blood loss is common in those with heavy menstrual periods and causes tiredness and breathlessness. Even obesity and a lack of fitness can cause persistent breathlessness. So what happens in clinic? In this day and age, a lot of medical conditions can be managed remotely and over the phone. With breathlessness though, it would be rare for us to not want to see you on the same day to examine and see you in person. We want to know more details about the breathlessness, like how it started, quickly or slowly, and did anything trigger it? How far can you walk before getting breathless? And do you have any other symptoms like cough, weight loss, or fever? This may indicate a chronic infection like TB. Have you traveled abroad recently or had surgery? This can sometimes relate to a clot in the lungs. We often grade your breathlessness using a scoring system to assess the severity. It looks a bit like this, with a score of 1 associated with no difficulty in breathing and a score of 6, which is breathlessness at rest, with varying degrees in between. This helps us to quantify the degree of breathlessness and to monitor progress. After this, we check your vitals, heart rate, oxygen levels, temperature, and blood pressure. We'll always examine your heart and lungs, and depending on the exact history, lung function tests, a chest x-ray, and blood tests would often be arranged. Depending on the severity of your symptoms, it's not uncommon for us to either send you directly to the emergency department from your GP clinic if it's really severe, or refer you to either a lung or heart doctor routinely for further investigation. Treatment depends on whether the breathlessness is acute or chronic, how severe it is, and what the likely cause is. If you're very breathless, try to keep calm. Call the emergency department if your symptoms are severe and sudden, or your GP if not. If you have a pre-existing condition, take any appropriate medication, such as your reliever inhaler if you're asthmatic, or a rescue pack of medications if you have COPD. If you have ongoing breathlessness, there are a host of modifications that you can make to breathing that can really help your day-to-day quality of life, including things like breathing techniques, postural modifications, and lifestyle changes. For more information on this, check the link in the description below. Sudden onset shortness of breath could be a medical emergency. Seek urgent help if you have severe symptoms. Breathlessness can be sudden onset, or you can have had it for a long time, or an episode of sudden worsening shortness of breath with someone who has long-term problems. The main causes are due to lung disease, heart disease, anemia, or a panic attack. For sudden onset shortness of breath, you will always need medical assistance, and the treatment is dependent on the cause. For chronic shortness of breath, breathing, positional, and lifestyle changes can make a big difference to how shortness of breath affects your life. Many thanks for listening. Till next time, stay healthy.